I've been waiting for this.
Local performer Justin Renaissance knows the impact of HIV firsthand.
I've been searching for the answer. What went wrong?
I still actively have friends who pass away from this. And that is the reality. It doesn't just affect people in the LGBT community, it affects everybody.
The Centers for Disease Control and Prevention currently provides about 91% of federal funding for HIV prevention in the U.S. State and local health departments, along with community-based organizations, depend on this funding for HIV testing, education, and access to pre-exposure prophylaxis, or PrEP, a medication that helps prevent HIV. Now, the Trump administration is considering cutting these funds or moving the programs to another federal agency.
And if the Trump administration's goal is government efficiency, prevention services are so much less expensive throughout the healthcare context.
Kara Desert runs the San Diego LGBT Community Center. She says the center could lose about $100,000 in funding. The potential CDC cuts aren't the only concern. More than $3.6 billion in federal housing grants are also on hold.
Because of this concern about DEI, supposed concern about DEI, they may cut funding for any of those programs just because this program is administered by an LGBTQ organization like the Center.
Congressman Scott Peters visited the center last week, pushing back against the proposed cuts. Health experts warn that shutting down the CDC's Division of HIV Prevention could trigger a public health crisis reminiscent of the HIV pandemic in the 1980s. Adolescents and young adults make up about 19% of new infections annually in the U.S. Justin Renaissance says prevention is key.
The younger generation definitely needs proper education on this, and preventative care is 100% the way to go. We can't get rid of that.
The administration hasn't announced a final decision, but advocates say losing this funding would set HIV prevention efforts back decades. Heidi de Marco, KPBS News.
Some of yourself.